Welcome to the DC Now podcast. This is Rose.
And I'm Dina.
And we're here with Erin Pollitt from the DCFNE, and we have a lot of great questions. So I guess we can get started.
Thank you for having me today.
One, could you explain what the DC Forensic Nurse Examiners is and how you got involved?
Absolutely. So again, thanks for having me today. I'm Erin Pollitt. I'm the Executive Director of the DC Forensic Nurse Examiners. We are a nonprofit in Washington, DC, and we're the sole provider of medical forensic exams for adults and one of two providers for adolescents in Washington, DC. What that means in layman's terms is that we are the nurses who are specially trained to care for people who've experienced violence. And what that means for our organization is that we respond 24/7, 365 to folks who've been sexually assaulted and who've experienced domestic violence in the District of Columbia. Oh, and how did I become involved?
Yeah.
Sorry about that. I became involved. So I'm the executive director, but I'm also a nurse. And so I initially started as an emergency department nurse. I was an ER nurse for 10 years. And I worked as a forensic nurse in Baltimore for 5 years before I was recruited to come work at DCFNE as the nurse manager. DCFNE is unique in that we have 24/7 staffing and full-time, well, the staffing part is not unique, but full-time forensic nurse positions, that was unique. And so that's part of what drew me to come work for the organization as the nurse manager back in 2016. And I was promoted to the executive director role in 2019. So I started as a nurse and now I am in this role.
So is the forensic nurse part of the city government, or are you a nonprofit separate from that?
So DCFNE is an independent nonprofit organization. We've been in that format since 2013. So we're very proud that this year was our 10-year anniversary as a nonprofit. We did, however, originate from the DC SANE program, which before 2013, that actually was an extension of the DC government. It was part of the Office of Victim Services. Now, in our current format, we are independent, and that allows us to really focus on having expertly trained nurses and really making strategic moves that best serve patients and survivors of violence in DC without having a lot of government red tape, for lack of a better term. We think that this makes us more resilient and able to respond to change easily. We are still largely funded, though, by the Office of Victim Services. So while we are not a government program, we do receive a lot of district funding in order to make this organization responsive.
And where else do you get funding aside from the city government?
So we do receive funding from private foundations. We receive some funding from the DC Health Department. And, you know, as a nonprofit, we receive generous donations. So we have to do fundraising as well to keep our doors open in that respect.
Can people from Virginia or Maryland get services? Like, how does it, in terms of when people call you, or do you kind of forward them to the respective state or county or whatever?
That's a great question, and it's a little bit nuanced. So we absolutely serve folks from anywhere. So if, you know, we oftentimes will get a survivor who's come back from vacation somewhere far away, and they're seeking services back when they get home. And, you know, we will complete whatever parts of the exam they want and serve them. It is a little bit different when we have Maryland and Virginia, being that those jurisdictions are so close to us here in DC. So while it's feasible We offer the service to see a patient, right when they come in our door. We're happy to see them, but we also want to offer them the choice to transfer back to the jurisdiction where the assault happened. The reason that we make that offer is because it can open the door for more financial compensation and reimbursement through crime victim funds if the patient receives care in the jurisdiction where the crime happened. That's just a fact. And so, we want to make sure that for all of our survivors, we really value informed consent. So we give them the choice. Hey, you're here in DC. Even if the crime happened in Maryland, we're happy to do your exam here in DC, or we can facilitate a transfer where you might be eligible for the Maryland Crime Victims Fund, for instance.
Okay.
Wow. So you really have a lot of knowledge, Erin, about not only the medical part of this, but the legal part and the police, et cetera. So why do you think your specialty came to be needed?
Oh boy. Well, I think that, it happens to be Nurses Week when we are recording this podcast. I don't think we planned it that way, but, nurses are the most trusted profession year after year. And when you think about somebody who's been assaulted, they need somebody that is trauma informed and compassionate and someone that they can trust and who's not seen as a part of law enforcement. So, it's not as comprehensive care if you've just got a crime scene tech swabbing someone's body, right? We need something that's more trauma informed. And, forensic nursing is still a relatively new subspecialty. By relatively new, I mean 30 years, which, in the world of nursing, that's still pretty new for a subspecialty. But, I think that part of what, brought this subspecialty to be is that need for trauma-informed care that's patient-centered and not crime scene-centered.
Definitely. I think that I'm very impressed with your organization. The last I heard, something like 1/3 of women will be sexually assaulted in their lifetime. And I'm wondering why this isn't part of nursing school, since that's a pretty high number. And you may not know the answer to that.
Well, I think it has something to do with just the fact that it's a newer subspecialty. I am with you in that I think that it should be more prioritized in nursing school. When I went to nursing school, I graduated longer ago than I like to admit. When I went, it wasn't a part of nursing school. And so one of the things that excites me these days when I'm, interacting with folks from the community or interacting with nurses who are, hoping to go into this profession, I get really excited when they tell me that they learned of this when they were in nursing school, or some say they learned of it when they were in high school, which just, that tells me that, oh my gosh, it's working. The word is getting out. And I think there are more government programs now, such as the HRSA grant, Health Services Administration, that has a focus on training SANEs. And so I think that that's doing a lot to get forensic nursing in the forefront of university education. So it's coming up, but still a long ways to go.
I think that's fantastic. I think it was on your website. I saw that you are the leader in this in the country, but are there others around the country?
Absolutely. And so, we're definitely, we're involved at a national level. So there's actually an international association of forensic nurses. That's the professional association for our field. And so, there are many SANEs across the country and across the world in different formats, but we are certainly, we're the only one for adults in Washington, D.C. And we like to stay involved at a national level and keep current with what other organizations similar to ours are doing. We're definitely not the only ones.
Could you talk about how many, on average, how many patients do you have, and what is like the gender or sex? Like, what percentage are men versus women?
Sure, absolutely. So in our last calendar year, in 2022, we saw 855 survivors. Now, for us, that includes folks who've experienced sexual assault, intimate partner violence, so assault by a current or a former intimate partner, as well as family violence, so assault by a family member, non-relationship, or non-romantic relationship, I should say. And of those, it is overwhelmingly women that come to see us, and we had 10% were males in 2022.
Did you notice any differences during the pandemic in terms of the number of patients?
So we did see a little bit of a difference during the pandemic. You hear on the hotlines and the outreach during pandemic that hotline numbers were going up, but we kind of found our numbers going down for a small period of time. Now, currently, we've exceeded our pre-pandemic numbers, but during the pandemic, we kind of attribute that to the fact that someone might be isolated in their home with the abuser. They might have, other things that they need to tend to, such as their children are home from school and they can't just, go and get an appointment or go wait in a very busy emergency department. So during the pandemic, we actually had to find new or non-traditional ways to reach our patients. We began doing telehealth consultations, and we really built up a robust off-site clinic practice so that folks had an option to be seen somewhere that wasn't a hospital, right? Because hospitals, folks might want to avoid a hospital for many reasons, right? One, a big pandemic, large wait times. Two, maybe they've experienced mistreatment by systems of health in general, or by engaging in a formalized system. So, all of those we kind of took into account, and we, developed an off-site non-hospital exam protocol for folks who didn't need medical care. And so all of that really kind of grew during the pandemic.
How do women find out about you? Through their doctors or some other way?
So we're really, we're out in the community. We're trying our best to spread the word and do outreach. We've connected with all the hospitals in DC and provided training. We connect with all the federally qualified health centers. We are open to connecting with any community group or healthcare provider that listeners of this podcast might like to connect us with. We have a person who it's their full job to do community outreach. So folks can request a training at contact@dcfne.org if they would like a training from us or outreach materials to display or to be sent. Additionally, someone might just call the DC Victim Hotline, which is a general hotline number for folks in DC, and it's for victims of all crimes. If they call the DC Victim Hotline and they say that they need services for either sexual assault or domestic violence, the hotline is trained and they're a partner of ours, so they will offer our services as well.
As an organization, what is your biggest challenge?
Our biggest challenge, well, as a nonprofit, I do have to say financial sustainability, which is even more such a challenge when nurses are, really underpaid, and we're trying to treat our staff right and make it a place that they want to work and that they want to stay. So, the competition for nurses is tough. So definitely being able to, keep getting those non-restricted funds that we can use to really bolster and train our nursing workforce and retain them. That part is important. And then kind of what I touched on before, spreading the word about our services, because, folks tend to only know about us if they need us. And so we feel like the more that folks are just aware that this service exists in DC and that it's free, and that it's easily accessible 24/7, that type of awareness is something that we're always working to be better at.
Could you, and this is a long question, could you go through the steps of the exam, or what happens when a patient goes to you?
Absolutely. So I'll preface it with, an exam can be as much or as little as the patient wants. So the length of exam will typically vary depending on what the patient chooses. Lovingly, we'll say it's a choose your own adventure, or it's a buffet, and you can take as little or you can leave what you don't want. Typically, the things that get offered would be a head to toe full body exam, where we document everything that we see, including, possible injuries, including any potential evidence that's found on the body. We might take photographs of the body if the patient consents to that, and we kind of write up what ends up being a 30-page medical forensic record of all our findings. For folks who've been sexually assaulted and come to us within 5 days of the assault, we can offer to collect a sexual assault kit, which is, in layman's terms, folks call it a rape kit, but we don't like that term. We call it a sexual assault kit. And that'll be the swabs of their body in the areas that were contacted for potential DNA. We can also offer toxicology testing, which we partner with the Office of the Chief Medical Examiner in DC to test if folks think that they might have been drugged. We can send blood and urine that would run, that the OCME would run tests to determine if there was any substances in their blood that might have caused them to be incapacitated and not able to consent. Some other things that we offer, we offer medication to prevent an unwanted pregnancy from a sexual assault, or to prevent sexually transmitted infections or HIV. We also offer advocates, so we partner with advocacy agencies, and so all of our patients get connected to an advocate who's either with them during the exam or has follow-up with them after the exam. And so for all these things, there's, the patient can choose as much or as little of that as they want. And I do have patients that maybe they'll say, I'm only interested in one thing off of that list, and that's fine. We'll do whatever they want, as long as it's medically and forensically indicated. They can take as much or as little.
And these are covered by insurance?
So actually, it is illegal to bill a patient for a SANE exam. That's one of the things under the Violence Against Women Act. And so we partner, our partner hospital is MedStar Washington Hospital Center. And we partner with their billing department to make sure that patients don't get billed for this type of exam. And when there are extra bills, for instance, something if they need, follow-up care or, other services after the fact that might get billed, we help them to apply for Washington, D.C. crime victims compensation program that tries to fund these costs as well.
That is fabulous that it's free. So important.
Absolutely.
And I'm glad. I was going to ask you a follow-up, like, what if that was a city law or if that was a national law? But thank you for saying that it was because of Violence Against Women Act.
Yes, that's right.
So I'm going to get a little political. That's what I do, Erin. The work you do, it's really both health and forensic. Obviously, that's your name. The last time I became aware, the domestic violence, the sexual violence kits or the rape kits do not tend to be processed too quickly. Has that changed? Do you know?
I do know. So across the country, this varies by jurisdiction. But in Washington, D.C., there are laws in place to make sure that there aren't delays in the testing of these sexual assault kits. And so in Washington, D.C., the local law that you would want to refer to is we call it SAVRA, which stands for the Sexual Assault Victim Rights Act. And then it had an amendment act. So there's SAVRA, the Sexual Assault Victim Rights Amendment Act. Most recently, the amendment was in 2019. But that law is basically like a survivor's bill of rights for DC, and it says that survivors have a right to a confidential advocate, that folks need to get the results of their sexual assault kit and that the kits get tested in a timely manner. And so in Washington, D.C., there's zero backlog of sexual assault kits, and we attribute that largely to that law and the processes that our partners at the Department of Forensic Sciences have put into place to make sure that the kits get tested timely.
That is amazing news. I'm so glad to hear that.
I guess the other question that's related to the kits is, do the kits have to be sent to the police to be investigated?
So, one thing is that we take anonymity very seriously around here, right? We don't ever want to give someone's details or identity away if they have said that they don't want police involvement. And so in Washington, D.C., kits are not tested unless they've been reported, because the kits are tested through the crime lab, which is affiliated with MPD. And so somebody would have to have their name be known to the police in order to have a kit tested. So we don't run a test on a kit blindly, because that would give up someone's anonymity. However, we do offer the option that if someone isn't sure if they want to report or not, DCF&E will offer to collect a sexual assault kit and hold it for that survivor. So they can decide, and we'll call them and check in with them. They can decide if they want to turn it over to be investigated. So it won't be investigated unless we turn the kit over, but we do offer an option where they could have a kit collected and think about it. so that they don't lose any potential evidence that's on their body. If they're not ready to report today, we can collect the kit and hold it for them. And we offer that non-report option. But that kit doesn't get tested because in order to do so, we'd have to tell their name and all their details to the police. And so we just hold it for them.
How long will you hold it?
So right now, we tend to check in with them at 6 months, 1 year, and 2 years. If they request at 2 years that we continue to hold it, we'll hold it indefinitely. We just have to remain in contact with them.
This is just a fantastic service, and I wish it could be replicated everywhere in the country. And maybe we'll be able to raise enough money, Erin, to send you on the road one of these days. But in the meantime, how can people help if they want to help your organization?
How can you help? Well, I mentioned spreading the word about our services so that folks are aware, and that can look like, simply telling your networks about us and arranging for a presentation with one of our outreach folks. That can look like, displaying a poster. We have lots of outreach materials we're happy to send to folks, if they want to display it in their doctor's office, in their lounge, in their, whatever community setting that folks could potentially benefit from seeing that information. Also raising awareness, that can look like interacting with us on social media and sharing our posts and, interacting and engaging so that your communities are aware. I also mentioned, on the other hand, as a nonprofit organization, we do rely on donations to help keep our doors open. We typically rely on the Office of Victim Services and Justice grants to fund the direct services. But we still need money for overhead. And if you've been paying attention at all to the Washington, D.C. budget, even that is in jeopardy this year with proposed cuts to the district's victim services. But fundraisers on our behalf are always welcome.
Well, you maybe can't say it, but I will say that anyone listening to this who lives in the district, to be sure to call your counselor and the mayor's office to voice your opposition to those cuts. Rose, do we have anything else?
Yeah, I do, although I should have asked it earlier. So when I was asking about the number of patients, what percentage of people don't do, and if you know the data, don't come to your organization after being assaulted?
I wish we had more insight on that. It's one of those things where you don't know what you don't know. So, we don't necessarily have a running tab, nor have we been able to really place our finger on it in our program evaluations, how to get a hold of folks who decided that they didn't want forensic services at all. So that admittedly, that is somewhere where we're kind of lacking in data. And we acknowledge that, we're only as good as the folks who know about us. So that's why we really are motivated to spread the word.
Well, we'll do our part, that's for sure.
Thank you.
Hopefully this podcast will reach people who have not heard of you and your really critical, good work in the district.
Yeah, thank you so much.
Thank you for having me on, and I'm happy to share an email address and the contact info if you want to put it in the footnotes or whatever printed part of your podcast description in case folks want to reach out. We're always happy to connect with
We will.
organizations.
Thank you.